Debbie, that brings you back with us because you have an incredible story, which was difficult to believe when you first talked to us about it, to do with anorexic patients.
Yes, it is. It's a very harrowing and difficult segment. And I would, in advance, ask viewers for their experiences, because there are going to be many that have been affected by anorexia nervosa. And so this story will be very poignant to them. So anorexia is classified as a severe mental health illness, but we already know that the waiting list for youngsters waiting for advice, assessment and treatment for mental health is surging, including those with food disorders and eating disorders. So I was very shocked to see the headlines on the Telegraph recently saying that anorexia patients may be given palliative care, not life-prolonging treatment, under new NHS guidance. This is incredibly alarming. So I went on and had another deep dive into this and saw another story from the Sunday Telegraph, which I've highlighted here, which is saying that patients as young as 18 who are at risk of dying from anorexia may be given palliative care rather than treatment to prolong life under new NHS guidance. A leading eating disorder psychiatrist called for the alarming guidelines to be repealed, whilst a senior MP described putting anorexia sufferers on a palliative pathway as horrific. Now, this pathway is called CED, and we'll come into the CED pathway. I think the term is extremely interesting. But just carrying on that article a little bit, the authors of this paper, this CED pathway, seem to suggest that their approach would come from reducing costs associated with lengthy admissions to specialist eating disorder units or acute hospitals, which I find particularly shocking. Tory MP Caroline Noakes has said to put sufferers on a palliative pathway is just horrific. Particularly concerning is the failure to consult the Royal College of Psychiatrists. So I went a little bit further to see who had written this paper suggesting that this CED pathway should be considered. And we're talking about considered for the NHS here. So I went to look at the paper, and there it is, a PubMed paper, Caring for Patients with Severe and Enduring Eating Disorders. That stands for CED, Certification, Harm Reduction, Palliative Care, and the Question of Futility. So if we look at the abstract of the paper, we can see, please freeze the screen and read all of it, and you can access the full paper online. But at the bottom there, it says, in addition, patients with CED may also contemplate whether a compassionate death would be better than an ongoing lifetime of suffering. In this review, we outline arguments for and against the concept of futility in CED and explore whether or when patients are competent to make the decision to die. So I went to look at the authors of this paper, and I was interested to find that these are two American psychiatrists, and I'll come on to the relevance of that in a minute. So we're looking at Patricia Westmoreland, who is a forensic psychiatrist. She's also a diplomat for the American Board of Psychiatry, and she's also worked for a very long time in Department of Corrections at Iowa. And we're also looking at Philip Mehler. Now, Philip Mehler has been named as a Doctor of the Year. He's got huge amounts of publications out, and he's been honoured for his work in eating disorders. Now, I just want to make a quick comment with regards to these two psychiatrists who are from America. We must remember that in America, they use something called the DSM criteria. Now, the DSM criteria is the Diagnostic Statistical Manual of Mental Disorders. This is a completely different coding system in the USA than we should be using in the UK. In the UK, we should be using something called ICD-10. Now, that stands for the International Statistical Classification of Diseases. And both these are almost clinical tools to help psychiatrists make a diagnosis. In the UK, in Europe, we shouldn't be using DSM-5. And I've had many a challenging conversation around a government board table about this. But it seems that British psychiatrists are using American diagnostic tools. Is it happening in the UK? Yes, I'm afraid it is. It's being offered. I've just brought up one NHS trust here for you to see, which is Avon and Wiltshire. And there you can see I've underlined that they do offer the severe enduring eating disorders CED pathway. My biggest question, I think, on this, gentleman, is this the start of a bigger agenda? And how are people feeling out there that are affected with anorexia nervosa? Because I find this whole story and the fact that the NHS guidance has already changed completely shocking.
Yes, I wonder what the last regime that considered mental health as a justification for early death was.
I think that would have been the Nazis with the T4 program, Mike, is what it is. But it's interesting, isn't it? We criticise a lot of MPs as being very weak, ineffectual people, but that MP was saying it was horrific, which indeed it is. So the NHS as a care system has allowed a horrific policy to come in. But I challenge you, Debbie, I don't think this is some new bad policy. It's simply a continuation of something that never went away, which was the Liverpool Care Pathway, which was the intent of the NHS to destroy people's lives. And this is another arm of it. So in a way, we shouldn't be surprised. What it tends to say is that we should be getting in the clinical psychologists and the psychiatrists to actually have a look at the personalities of the people running the NHS and bringing in these horrific policies.
Yes, okay. Well,